Hello and very good evening, everyone. So, I just hope we all are doing okay. I am audible, I am visible, सब okay चल रहा है. Just give me a thumbs up in case you can just see everything and you are able to listen also. Okay, great, great, great. Very, very nice. So I think, yeah, I can also see everyone. I can also hear to everyone. आपकी चैट बस मेरे को थोड़ा सा सेट करना पड़ेगा. आई एम जस्ट सेटिंग अप माई स्क्रीन राइट नाउ. एक सेकेंड के लिए. देन वी आर रेडी टू गो. Okay. So I just hope we all are doing well. आपकी तैयारी ठीक चल रही होगी. Yeah. चलो. Today's session, छोटा सा disclaimer है. Today's session will be slightly longer session. And IPL मैच छोड़ के सर आपसे पढ़ने आए. डेडिकेशन देख रहे हो बच्चों का सर. विक्की क्या बात है यार. क्या डेडिकेशन है. सो नाइस ऑफ यू. थैंक यू वेरी मच यार. आपने IPL मैच छोड़ा यार कम्युनिटी हेल्थ नर्सिंग के लिए. अब रुलाओगे क्या इसके ऊपर. सो या जो आपका प्री का एग्ज़ाम गया था वो कहते हैं कि भाई इसमें काफ़ी इधर उधर से क्वेश्चंस आए एंड ये था वो था. बट आई फील मोस्ट ऑफ द क्वेश्चंस हमने ऑलरेडी क्लासेस में कर रखे थे बेटा. मोस्ट ऑफ द क्वेश्चंस हैव ऑलरेडी बीन डन इन द क्लासेस. सेम टॉपिक्स हैं, सेम सब कुछ है, सेम चीज़ें चल रही हैं. एंड अगर आप उन्हीं चीज़ों को रिवाइज कर रहे हैं तो बस नए क्वेश्चन सेम टॉपिक से आ रहे हैं. चलो. वेरी नाइस, वेरी नाइस. ऑल दोज जो इतने बड़े बड़े त्याग मूर्तियाँ आज हमारे साथ शामिल हैं, आप सबको बहुत प्रणाम एंड आप सबका बहुत अभिनंदन. आपका बहुत धन्यवाद कि आप लोग इतना बड़ा मुंबई इंडियंस का मैच छोड़ के आज मुझ गरीब को सुनने आए हो. तो कोई बात नहीं, कभी कभी थोड़ी सी पढ़ाई भी कर लेनी चाहिए. आज एग्ज़ाम सेशन वुड बी स्लाइटली लॉन्गर सेशन. सो बस यही है, थोड़ा तैयार रहो. खाने पीने का अपना सिस्टम अपने पास रखो एंड डोंट आस्क फॉर ब्रेक्स टू मच इन बिटवीन. तो हाँ, वही मैं कह रहा हूँ ना. डिट्टो आया था. मोस्ट ऑफ द स्टूडेंट्स टोल्ड मी कि भाई एग्ज़ाम से जिन्होंने पढ़ाई प्रॉपर तरीके से रिवाइज किया है वो सब चल रहा है. NFHS 5 गुरुजी पढ़ा देना. जेठाराम NFHS 5 छोड़ो, NFHS 6 आ गया है. तो NFHS 6 की तैयारी करनी है. चलो. So yeah, I think many of the students are also from down south, and yes, we are going to take the whole session in English, beta, and we don't want to have any disparity on English and Hindi. But yes, I'll try to mix and match both the languages, but predominantly we are going to take the session in English language. So, coming to question number 1, please just have a look at the question. And regarding the management of close contacts. Regarding the management of close contacts. क्या बोलते हो? What do you want to say regarding the management of close contacts of diphtheria case? Which of the following statements is not correct? Throat swab culture should be assessed for the contacts. Erythromycin should be advised for 7 to 10 days. No vaccine is required if the last dose was taken within 5 years. And diphtheria antitoxin should be given within 5 days of exposure. No vaccine to be given. Erythromycin 7-10 days. Throat swab. क्या बोलते हो? What do you think is the best answer? What do you think is the best answer over here? बेटा, you guys need to answer, otherwise like it becomes very boring. क्या बोलोगे तुम लोग? Okay, most of you are going with option C. Most of you are going with option C. काफ़ी लोग इसमें ऑप्शन सी के साथ जा रहे हैं. ओके, कुछ लोग ऑप्शन बी के साथ भी हैं. सी, दैट्स हाउ द थिंग्स वर्क. That's how the things work. This is a very frequently asked topics. In fact, most of the questions, all the questions which I will be discussing today, all are kind of 5-star important topics, and these 5-star important topics are bound to be asked in your exam again and again. These 5-star important topics will be asked in your exam again and again. Only booster dose required if last dose was taken more than 5 years. Okay. So if we talk about a diphtheria case, beta, if we talk about diphtheria case, ये सारे काम हैं जो diphtheria के cases में करने हैं. So any diphtheria case, any case of diphtheria, we are going to give first is diphtheria antitoxin. Second, we are going to give antibiotics. Third, we are going to do serial cultures. Why do we do serial cultures? Because in diphtheria case, आपको patient को isolate करना है. कब तक isolate करना है? Till 2 negative throat cultures. Till 2 negative throat cultures, we need to isolate the cases of diphtheria. Antibiotic, same answer, penicillin G, oral erythromycin. Carriers में, please remember it is oral erythromycin for 10 days. अब ये जो सवाल आया है, this question was for close contacts. This question was for close contacts. So close contacts में हमें क्या करना है बेटा? I have shared this PDF also. ये हमने classes में भी बहुत बात किया है. That the drug of choice we give is oral erythromycin, 7 days minimum देना है. Then we are supposed to give diphtheria toxoid vaccine also. So अगर last dose was taken within 5 years, no extra vaccine is required. More than 3 doses, more than 5 years, then हमें single diphtheria toxoid booster देना है. This is what is a booster dose. And अगर unknown status है, then we have to complete the toxoid series. 3 primary doses हमें देनी होंगी. And then we are also supposed to give the samples for diphtheria culture. क्यों culture क्यों करवा रहे हैं? क्योंकि यार culture तो करवाना ज़रूरी है. These are contacts of diphtheria case. And because these are contacts of diphtheria case, because ये लोग contacts हैं diphtheria case के, therefore ये culture कराना ज़रूरी है. क्योंकि आप ऐसा थोड़ी ना vaccine, you can't give it to the diphtheria case. Vaccine has to be given to people who are at risk of developing diphtheria, right? So vaccine has to be given to people who are free from diphtheria. So you have to check for diphtheria, signs and symptoms. You have to check whether the patient is having diphtheria, yes or no. So for that you have to do culture technically. Why? To rule out diphtheria. To rule out diphtheria in these cases, we have to do the samples for serial culture. So इस base पे, if you understand all this, what is the best answer? Regarding management of close contacts, diphtheria antitoxin should be given within 5 days of exposure. Why would you give antitoxin? मुझे ये बताओ, why would you give antitoxin? Antitoxin is given for treatment of diphtheria. It is given for treatment and it is not given for prevention of diphtheria in close contacts. It is not given for prevention. Throat swab cultures, yes, it has to be done. Erythromycin should be advised. Yes, it should be advised. No vaccine is required within 5 years. That is also true. So which is the only answer? Which is a wrong answer? Diphtheria antitoxin should be given within 5 days. This answer is technically a false answer. It is a false answer. And this is the correct answer you need to mark. Because आपको क्या ढूंढना था? You had to find the incorrect answer. Right? You had to find the incorrect answer. So please note, ऐसी mistakes should not happen in your exam. Question number 1. Next MCQ. A 40-year-old forest worker with documented complete pre-exposure prophylaxis against rabies taken last year, ठीक है, presents now with category 3 wild animal bite. What is the correct post-exposure vaccination regime? So 037 देना है without immunoglobulin, 0 and 3 without immunoglobulin, 037 with immunoglobulin, 0 and 3 with rabies immunoglobulin. So what do you think is the best answer? What do you think is the best answer? What do you think is the best answer? Okay, good. Right. Most of you are going with option B. Okay. Most of you are going with option B. कुछ लोग C भी कह रहे हैं. But yeah, mostly are going with option B. Very nice, beta. Very good. So what are the regimes that we have in rabies? In rabies, we have something called as the pre-exposure prophylaxis. We have the pre-exposure prophylaxis. Pre-exposure prophylaxis. Let's very quickly revise the regimes. The regimes in rabies that you have to revise. The regimes in rabies that you have to revise, beta. We have a pre-exposure prophylaxis which is given to high-risk occupations. It is given in 3 doses and it can be given intramuscular or intradermal. It could be given anything 0, 7 and day 21 or 28. Second is we can also have a post-exposure prophylaxis which is given after a dog bite. After the dog bite, we can either give a SN regime or we can give a Thai Red Cross regime. Point to be noted, SN regime, ESSEN. How many alphabets, how many letters? ESSEN. So how many days? 1, 2, 3, 4 and 5. So there are 5 visits. Remember, SN regime, 5 visits and there are 5 doses. It is given as 1 dose every visit. And it is given as intramuscular injections. Please remember, this is given as intramuscular injection, 5 visits, 5 doses, SN regime. On the other hand, if you talk about the Thai Red Cross, Thai Red Cross, beta, THAI. So how many letters? 4 letters, THAI. So it is given on day 0, day 3, day 7, day 14 cancel ho jata hai, and day 28. But in this, how many visits are there? 4 visits, but every visit there will be 2 doses. Remember, 2 doses, 2 doses, 2 doses, 0 dose and 2 doses. So this is Thai Red Cross is 4 visits and 8 doses. 4 visits, 8 doses, and Thai Red Cross is given as intradermal regime. So please remember, Thai Red Cross is given as intradermal regime, 4 visits, 8 doses. Pre-exposure prophylaxis mein how many doses? 3 doses, and you can give either intramuscular or intradermal. Last but not the least, when we have a re-exposure prophylaxis, whenever we have a re-exposure prophylaxis, then beta we are going to have 2 visits and we can give as intramuscular or intradermal, and this is again 2 doses. 2 visits, intramuscular or intradermal, and this is given in 2 doses. Re-exposure prophylaxis. Please remember, in re-exposure, no rabies immunoglobulin is given. No rabies immunoglobulin is given, and re-exposure, when are we going to give? कब देना होता है? Re-exposure we are going to give only if the previous vaccination was more than 3 months ago. So whatever patient might have taken more than 3 months ago, whatever the patient might have taken pre-exposure or the post-exposure prophylaxis, in those cases, if the last vaccine was taken more than 3 months ago, if the last vaccine was taken more than 3 months ago, only then we are going to give this re-exposure prophylaxis. Okay, so please make sure that you remember this by heart and you know what is the best answer to be given. In this, no rabies immunoglobulin has to be given. No rabies immunoglobulin and previous vaccination. If it was more than 3 months, only then we are going to give the re-exposure prophylaxis. So if you understand all this, so patient forest worker have a documented complete pre-exposure prophylaxis taken last year. Now this vaccine was taken last year. So obviously it was more than 3 months ago. So now this patient is having a category 3 animal bite. What is the best answer? Will you give a re-exposure? Yes, we are going to give re-exposure without rabies immunoglobulin, because rabies immunoglobulin is not a part of the re-exposure regime. So the best answer over here for you guys to mark is option B. बिल्कुल सही बोला. Please remember that rabies immunoglobulin is given only once a lifetime. It is given only once a lifetime. Let's move to the next MCQ. Which of the following Government of India program provides a cash incentive to the beneficiaries? Which of the Government of India health program provides cash incentive? पैसा किस में मिलता है? Monetary benefit किस में मिलेगा? In which are you going to get the monetary benefit? जननी सुरक्षा योजना, प्रधानमंत्री मातृ वंदना योजना, जननी शिशु सुरक्षा कार्यक्रम, प्रधानमंत्री सुरक्षित मातृत्व अभियान. 1 and 2, 1 and 4, 2 and 3, 2 and 4. कौन सा बोलते हो? Cash incentive is given under which program? Absolutely correct, beta. JSY and Matru Vandana Yojana. These are the 2 Government of India schemes which are providing, correct answer, cash incentive to the beneficiaries. JSY and Matru Vandana Yojana. फटाफट से चैट बॉक्स में लिखो, how much is the incentive which is given in Matru Vandana Yojana? Can you tell me how much is the incentive which is given in Matru Vandana Yojana? फटाफट से चैट बॉक्स में लिखिए दैट हाउ मच इंसेंटिव. तब तक हम JSY की बात करते हैं. JSY इज जननी सुरक्षा योजना. इट इज़ पॉइंट नंबर 1. इट इज़ अंडर मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर. द इंसेंटिव इज गिवन टू बोथ द मदर एंड द आशा वर्कर. इट इज़ गिवन टू बोथ मदर एंड आशा. आशा को क्यों देते हैं? बिकॉज शी हैज़ टू एस्कॉर्ट द फीमेल टू द हेल्थ सेंटर फॉर institutional delivery. She has to escort the female for institutional delivery. Absolutely correct. Everybody answering so nice. Matru Vandana Yojana, I think you all are good and you all are ready. In Matru Vandana Yojana, beta, the first installment is for 3,000. The second installment is for 2,000. Total, all in all, 5,000 rupees is given only to the first born child. 5,000 rupees installment incentive is given to the first born child. And if the second child is a girl child, अगर वो girl है तो second child में 6,000 rupees. It is a 10-star MCQ frequently asked in your exam. Do not forget Matru Vandana Yojana. Do not forget Matru Vandana Yojana. Right? Very nice. So the best answer over here, correct answer beta, is option number 1 and 2. That is the best answer for you guys to mark. Okay. Next in line, which of the following health schemes does not include monetary benefit? अच्छा, similar question है एक और हमारे पास. Which of the following health schemes does not include cash or monetary benefits? ये बताओ जरा. Which scheme does not include cash or monetary benefits? Is the voice very low? Do you want me to increase the voice? Do you want me to increase the voice? Acha, just let me know if you want to increase the voice. Amazing, very nice. Everybody answering correct answers. Very nice. It is which of the following health scheme does not include cash or monetary? Absolutely correct. Very nice. I'm proud of you guys. Very nice. Which of the following health scheme does not include the cash or the monetary benefits? So, Shramnik Kalyan Yojana, श्रमिक कल्याण योजना, मातृ वंदना योजना, निक्षय पोषण, प्रधानमंत्री सुरक्षित मातृत्व अभियान. Very nice, very nice. Absolutely correct. I'm so proud of you guys. Very nice. This is a good question and a good answer by everyone. So, Shramnik Kalyan Yojana क्या होती है? Just very quick for all the students who don't know about all these. So, what is a Shramnik Kalyan Yojana, beta? In Rajiv Gandhi Shramnik Kalyan Yojana, it is unemployment allowance. Shramnik Kalyan Yojana is unemployment allowance. It is under the ESI program under Ministry of Labor. It is under Ministry of Labor. So eligible workers will receive a cash allowance of maximum 24 months, that is 2 years during their lifetime. That is for retrenchment. That is just politely we say layoff. In legal language they say retrenchment. Forceful closure of company where they were working, or non-employment related injuries. In these cases we give Rajiv Gandhi Shramnik Kalyan Yojana. Very nice, very nice. So in this, is there a monetary benefit? Yes, there is a monetary benefit. Matru Vandana Yojana, yes, just now you learned. Nikshay Poshan Yojana, how much benefit we are giving? In Nikshay Poshan Yojana, please remember the benefit is updated. It is 1,000 rupees now given every month, per month. Till the time the patient is taking treatment, it is to improve the nutrition of the TB patients. So Nikshay Poshan Yojana, yes, the benefit is given in cash. Surakshit Matritva Abhiyan, no, this is not a cash benefit. In this, what is the thing we are doing? We are doing early ANC screening. Early ANC screening by specialist. We are doing early ANC screening by a specialist to find out what to find the high risk pregnancies. It is to find the high risk pregnancies. That is what is Pradhan Mantri Surakshit Matritva Abhiyan. Very, very nice. Under Prime Minister Surakshit Matritva Abhiyan, 2-3 points you have to remember. That PMSMA session is on 9th of every month. 9th of every month. This is important point. Next in line, you should remember that additional 3 antenatal visits will be there by the high risk pregnancy in case we get HRP. HRP is high risk pregnancy. So this is another important point. 3 additional ANC visits will be there. So this additional ANC visits, there will be incentives also. 100 rupees is given to ASHA workers for the additional 3 ANC for the high-risk pregnancies, and 500 for the healthy outcome of the baby on 45th day under the Pradhan Mantri Surakshit Matritva Abhiyan program. So on 9th of every month, the female will be visiting the PMSMA clinics, and in case she gets a pregnancy-induced hypertension, it is a blue category. In case of any other comorbidity, it is a yellow category. In case the female gets into high risk pregnancy, it is a red category, and in normal females, it is a green category. So these are the color coding which have to be there. Very nice. Let's go to the next one. Which of the following statement is not correct for the ESI program? Which of the following statement is not correct for ESI program? Indirect benefit is possible via empaneled hospitals. Permanent sterilization incentive is possible under enhanced medical benefits. Extended benefit is for 2 years for any disease up to 80% of the wage. And employee will contribute 0.75% of the monthly wage. What do you think is the best answer? But sir, CHC of month में 4 days होता है. 4 days is minimum antenatal care beta, and then in PMSMA 3 additional in case the female is high risk. So in case of high risk pregnancy, total 7 visits will be there. 4 normal हुआ and 3 extra हुआ for the high risk pregnancy. Okay, so what do you think is not correct? You have to find the wrong answer. ये सारे क्वेश्चंस जो हैं ये ताज़े पके हुए क्वेश्चंस हैं. These are new questions from the same topics. So these will only help you revise the things better. Absolutely correct. Absolutely correct. I'm so proud of you guys. Very nice. I'm so proud of you guys. कर दिया आप लोगों ने कमाल. Most of you are answering option C, but some are answering option D also. So beta, just a quick words about ESI. ESI, Employee State Insurance, ESI, it is under Ministry of Labor. Ministry of Labor. It is under Ministry of Labor. And इसके अंदर ESI के अंदर there are 2 types of benefits, direct benefit, indirect benefit. Direct benefit is by ESI clinics or hospitals. Indirect benefit will be by empaneled hospitals. इसके अंदर how much contribution has to be done? The contribution by the employee, that is the worker, it is 0.75% of the wage, and the employer, they will contribute 3.25% of the wage. Total 4% of the wage is given to the ESI corporation. It is 3.25% of the wage and 0.75 by the employee. So ये total ये लोग contribute करते हैं. And in this permanent sterilization के लिए there is enhanced. This is true answer. Extended benefit is for 2 years for any disease. Correct answer, it is not for any disease. It is for a total 34 diseases. It is for total 34 diseases for which we are giving the ESI, and that is the wrong answer. Employee will contribute 0.75. This is also true answer. So all answers are true except which one? Option C, which is the false one. So you have to mark the false one. Option C is the best answer for you guys to mark. Go to the next MCQ. Affordable medicine and reliable implants are safeguarded under which scheme? POXO, COPRA, Amrit, PMJ. What do you want to say? Affordable medicines and reliable implants are safeguarded under which scheme? POXO, COPRA, Amrit, or PMJ? Well, just having a brief word, very nice. Most of you are getting it correct. Just having a brief word about it. So, what is COPRA? COPRA is Consumer Protection Act, beta. COPRA is the Consumer Protection Act of India. Under this, all the consumers, it could be for any Jago, Grahak Jago, you must have seen the advertisement on reels and everywhere. So that is for Jago, Grahak Jago. That is Consumer Protection Act, COPRA. It is for any business, any organization. Next is Protection of Children from Sexual Offences. That is a POXO Act 2012. It is to protect the minors. Who are minors? This also has been MCQ beta. Who are minors? Protect the minors, that is age under 18, from any human trafficking, sexual abuse, exploitation, pornography. And it is also related to the BNS, Bharatiya Nyaya Samhita, BNS number 95. That is also related to the BNS number 95, and it is related with the POXO Act of India. What is Amrit scheme? Amrit scheme stands for the Affordable Medicines and Reliable Implants. Do not confuse it with Amrut. Amrut is AMRUT. Amrut is to provide better housing facilities in urban areas. Amrut scheme is to provide housing facilities in urban areas. And last is PMJ, that is associated with Ayushman Bharat. That is associated with Ayushman Bharat program, PMJ. Okay, don't get confused with all these. These are very basic questions. So POXO is not this, COPRA is not this, PMJ is not at all. So what is the best answer? Option C is the best answer for you guys to mark. Let's go to the next one now. Which of the following is not a target under the NP-NCD program? Which of the following is not a target under the NP-NCD program? What do you want to say? 50% reduction in smoking levels, 30% reduction in excessive salt intake, 10% reduction in alcohol abuse levels, and 50% reduction in the household air pollution. So all the MCQs, ये ताजे पके हुए रोटियां हैं, ताजे पके हुए MCQs are direct from the bakery for you guys. So try answering it. Okay. Good, very nice. Some are answering option C, some are answering option D. Most of you are answering option C, which is unfortunately an incorrect answer. Gopal, very nice. Gopal M1U8I. Very nice, very nice. So, Hari P2N. Hari ने भी सही आंसर किया. Very good. Which of the following is not a target under the National Program for Non-Communicable Diseases? I think ये program, this circle you must have seen in your copies. We talked about this in your classes also. NP-NCD एक दफ़ा पढ़ के जाना बेटा. Make sure that you study NP-NCD. It is kind of a 3-star MCQ frequently asked in your exam. So it is a 3-star MCQ frequently asked in your exam. This target you must have studied sometime or the other. That what are the risk factor targets for the non-communicable disease national program. So if you talk about the targets, just to help you simplify and remember the targets beta. So if you want to remember the targets for the program, you can remember the first target is to have 30% reduction in the major risk factors. Remember the major risk factors. That is to have salt levels 30% reduction and smoking levels we should have 30% reduction. Okay. Second in line बच्चे, we also need a 10% reduction. थोड़ा सा less है ना 30 से. So we also need a 10% reduction in two things, that is alcohol levels, alcohol abuse, and physical inactivity levels. Okay, so 30% reduction in salt and smoking, 10% reduction in alcohol, and third target is that if we achieve this, there will be 25% reduction in the outcome. What is the outcome? That is hypertension levels, there is 25%, and premature deaths. Premature deaths, there is 25% reduction. Premature deaths. So बस यही याद रख लो. How many you have remembered? 2 and 2, 4 and 2, 6. Out of these 12 things, half आपने याद कर ली. I think that is all that you require. Right? So if you understand this, 30% reduction in excessive salt intake, yes, this is true. 10% in alcohol, true. 10% in alcohol and physical inactivity. 50% reduction in household air pollution, ये भी true है. And there is 50% reduction in the smoking. No, this is wrong answer. It is not 50, it is 30% reduction. And therefore, this is your best answer to be marked in your exam. Therefore, this is the best answer to be marked in your exam. And that is the correct answer. Let's go to the next one. To study the prevalence of goiter in the district, the investigator divides the district into 4 zones. उसने divide किया district को 4 zones में. From each zone, villages are selected at random and all eligible adults are randomly selected in the households. All eligible adults in the randomly selected households in the villages are included in the study. Which is the best described sampling method? Which is the best described sampling method? Simple random sampling, stratified random sampling, cluster sampling, or systematic sampling? What do you think is the best answer? Okay, you think this is stratified sampling? Okay. जोर का झटका आपको धीरे से लगा, ये गलत आंसर है. Unfortunately, this is a wrong answer. It is not a stratified random sampling. We did not make the stratas here. Please remember, whenever you are taking villages at random, okay, so they divided into 4 zones. एक district लिया. So they took a district. They have taken a district, and the district has been divided into 4 zones. And from each zone, this was zone 1, zone 2, and then zone 3, and then zone 4. From each zone, they have taken villages in random. So यहाँ से कुछ villages उठाए, यहाँ से कुछ उठाए, यहाँ से कुछ उठाए, यहाँ से कुछ उठाए. This type of sampling is a cluster sampling. Because they divided into 4 zones, and then villages were selected at random. They divided into 4 zones, and then out of each zone, the clusters of the villages were selected. This is a typical example. If in case you had a multi-stage sampling, if in case you had option of a multi-stage sampling, if in case there was option that is multi-stage sampling, this would have been the best answer for you guys to mark. This would have been the best answer for us to mark, because you are divided into zones, zone divided into clusters. In the clusters, you are doing random selection of the households. So this is the best answer. But in our case, in these MCQ, in these options, there was no option of multi-stage sampling. The best answer you would like to mark over here is cluster sampling. Cluster sampling. Beta, if it was stratified, agar main aapki baat manta, if I would have agreed to you that this is a stratified sampling, if I would have agreed to you that yes beta, this is a stratified, in stratified sampling, the MCQ would have been that in a district, the population was divided based on income, or they could have divided based on occupation, or they would have divided based on education. They could have taken anything, but in our question, there was nothing of this sort. So this is what is a stratified sampling. Strata kuch to divide karoge, kisi cheez pe to divide karoge na. You can't say that divided into 4 zones is a stratified. That's a nonsense answer. If you divide the population into 4 zones, that's not stratification. It's actually you're dividing into zones, and within the zones you are taking clusters. Please remember, what do we mean by clusters? What do you mean by cluster? Cluster is a naturally occurring group of individuals or group of units. It could be houses. They are naturally occurring. So technically, village is a cluster. PHC, number of people coming to a PHC, sub-center, number of people visiting a hospital, all this is a cluster sample. So if you go to the area and you pick up 5 hospitals, you go to the area and you pick up 5 sub-centers, these are cluster sampling. And then you select the clusters randomly. And then within the cluster, once you select that, okay, in zone number 1, there were 80 villages, and out of 80 villages, I will select 80 villages are there. I will select 20 villages randomly. So what is this type of sampling? This type of sampling is a typical example of a cluster sampling. Arey bhaiya, this is what the MCQ was also saying. that you divided the whole area into zones, and in the first zone, for example, agar 80 villages the, out of 80 villages, you did not take all the 80 villages, you selected 20 villages randomly. Okay, so you took these random, it's kind of a multi-stage, एंड यहाँ पे आप रैंडम सैम्पलिंग भी कर रहे हैं एंड क्लस्टर्स भी यूज कर रहे हैं. सो व्हाट इज द बेस्ट आंसर? द बेस्ट आंसर आई टोल्ड यू इज अ मल्टी स्टेज. इफ दैट इज नॉट इन द ऑप्शन, यू हैव टू गो विद दिस द एसेंस ऑफ ए क्लस्टर सैम्पलिंग. The correct answer over here is cluster. What are clusters? Remember, clusters are naturally occurring groups. Anything could be a cluster. Usually, in your exam, they'll ask you about cluster sampling only, most of the times. Let's go to next MCQ. Which of the following is incorrect regarding the type of bias? So, what do you think is incorrect regarding the types of bias? What do you think is the correct answer? Recall bias is differential accuracy of the past exposure. Bias is a random error with study designs. Double blinding is most commonly used bias. The randomizer is also biased, is also blind in a triple blinding. What do you think is the best answer over here? What do you think is the best answer over here? क्या बोलते हो? करो, अटेम्प्ट करो. Very nice. I think got it. Everybody got this question. देखो मतलब that is what the examination is, when you are able to solve a question which is a new question, and I'm very sure कि ये questions you will not find in any mobile application, any book, ये कहीं नहीं मिलेंगे. ये सारे के सारे आज मैं 40-50 क्वेश्चन लाया हूँ आपके लिए. I've got around 40 to 50 MCQs and सारे के सारे all 40-50 are new MCQs from repeatedly asked topics, right? So all these MCQs are newly made MCQs just to help you be stronger for your exam, because आप लोगों को मेरे को strong soldiers बनाना है. That is what our organization strives for. हम लोग वो नर्सिंग नेक्स्ट में वी आर नॉट टू प्रोवाइड यू कि यार ये पढ़ लो, ये रट लो और एग्जाम में पास हो जाओगे, ऐसा नहीं. हम आपको वॉरियर तैयार करेंगे, जैसा मर्जी पेपर आए अपन निकल जाएंगे. सो तो ये देखो, विच ऑफ द फॉलोइंग इज इनकरेक्ट. यू हैव टू फाइंड द रॉन्ग वन, राइट? यू हैव टू फाइंड द रॉन्ग वन. Recall bias is differential accuracy of the past exposure. I'm explaining the options now. Recall bias is a differential accuracy of the past exposure. Yes, this is correct answer. Yes, this is correct answer, because recall bias कहाँ मिलता है? It is found in case control studies. So case control study में when you go back in a case control study में you ask them for the risk factor, and then वो लोग बोलेंगे कि we don't remember accurately. There is a differential accuracy in the past exposure. You ask them, भैया yes risk factor or no risk factor. That is what you ask ना. And controls also you will ask yes risk factor. So ये उनको याद नहीं रहता. This is what is a recall bias. Bias is a random error. No, it is not a random error. Beta, if you talk about errors can be of two types. We can have a random error, which is a sampling error, okay, which is there in sampling errors. And we can also have a systematic error, which is what we call as bias. So bias is not a random error. It is a systematic error. Double blinding is most commonly used to control bias. Yes, it is correct answer. To control bias, we can do blinding, beta. We can do blinding. Blinding can be of three types. We can have single blind, double blind, or triple blind. In single blind, only the patient is blind. In double blind, the doctor plus the patient, doctor or the nurse plus the patient. In triple blind, the statistician is also blind. So most commonly done blinding is a double blind. It is a true answer. The randomizer is also blind in a triple blind. That is what the statistician is. This is a correct option. That is the randomizer or the analyzer. It is also called as the analyzer or also called as the statistician. All three are blind along with the doctor, nurse and the patient. All three are blind. This is what is a triple blind. So if you understand this, which is the best answer for you guys to mark? The best answer for you guys to mark is bias is a random error. That is a wrong option. Bias is a random error. That is a wrong answer. Right? That is the wrong answer. Let's go to next MCQ. This vaccine is given at birth and only within 24 hours. It is placed in which zone in the ILR? What do you want to say? 1, 2, 3 or 4? So this is what is ILR. I hope you all know what is ILR. ILR stands for the ice-lined refrigerator. Ice-lined refrigerator. So where would you put this vaccine? The vaccine is given at birth and only within 24 hours. Absolutely correct. Most of you are going with correct answer. That is option A. Very nice. It is, we are talking about hepatitis B. It is option A, that is hepatitis B. It is kept always in the top shelf. Acha, if I change this MCQ, the same MCQ, if I change this MCQ, okay, the same MCQ, if I change this MCQ, and I say that in this question, now they are not saying, now I say that they are not saying only within 24 hours. It can be given within 1 year. What is the best answer? This vaccine is given at birth and only within 1 year. It is placed in which zone of the ILR? क्या बोलते हो? क्या बोलते हो? Which zone? What is the correct answer? 1, 2, 3 or 4? Okay. ठीक है, बट थोड़ा सा गलत हो गया आंसर. एक बच्चे ने सही किया. आई एम जस्ट ट्राइंग टू सर्च हु गेव द फर्स्ट आंसर, करेक्ट आंसर. थोड़ा सा गलत हो गया. एवरीबडी आंसरिंग करेक्टली, बट लिटिल बिट गलत हो गया आपका आंसर. नेहा कुमारी, वेरी नाइस. सो इफ आई रिपीट दिस MCQ, ओके, जस्ट वेट. थोड़ा सा गलत हो गया. इफ आई रिपीट दिस MCQ, ओके, चलो एक और गेम. If I repeat this MCQ के ठीक है जी, it's not within 1 year. If the MCQ says it can be given within 15 days. अब बोलो क्या आंसर है? This vaccine is given at birth and only within 15 days. What do you want to say? हाँ, very nice. Everybody got the point. Very nice. I knew, मुझे ये पता था कि आप लोगों को आता है ये सब, but just because खुशी बहुत थी कि मुझे आता है, तो गलत आंसर हो गया, तो चलता है. That's okay. So, but I already knew that you guys must be knowing this concept. That very nice, beta. In fourth zone, we are going to give the OPV. OPV is always kept in the bottom shelf. And in the third zone, we have is the measles, rubella and the BCG. They both are available at the third zone, and the top zone is always made with the hepatitis B. The second zone is with the pentavalent vaccine and the PCV vaccine. The second zone is with the pentavalent, and the middle zones, in this we'll be keeping FIPV, the TD vaccines, the TT vaccines. They all will be kept in the middle zone. Okay. So yeah, I knew that you all knew the answers, but I just wanted to play with you guys. So absolutely correct. Within 15 days, that is, we are talking about OPV. OPV is the best answer over here. And in the previous MCQ, which was for the 1 year, in this MCQ, what is the correct answer? It is option 3, because we are going to we are talking about BCG vaccine. And then in this, hepatitis B is the correct answer. 3 questions, different variants, एंड दैट्स इट सर। पी वैल्यू एक दफ़ा, पी वैल्यू को अभी इसमें छोड़ दो, पी वैल्यू स्टैट्स वगैरह में करना। कितने तेजस्वी लोग हैं, सही बात है, बहुत। आशा वुड डू डैश नंबर ऑफ विजिट्स फॉर अ 3 month old चाइल्ड बॉर्न विद होम डिलीवरी। क्या बोलते हो? क्या बोलते हो? व्हाट डू यू वांट टू से? आशा वुड डू डैश नंबर ऑफ विजिट्स फॉर अ 3 month old चाइल्ड। आई एम वेटिंग फॉर योर आंसर्स। ऑप्शंस आर 4, 5, 6, 7। सो वेरी नाइस, आई एम सो प्राउड ऑफ यू गाइस। मैंने आपको धक्का देके उसमें फेंकना था और आप गिर गए। आई थिंक आई गॉट वन करेक्ट आंसर अभी तक। मैंने गूगली क्वेश्चन था ये बेटा, ट्रिकी क्वेश्चन, गूगली क्वेश्चन, एंड जो मैं चाहता था वो आपने किया। यू ऑल डिड द सेम मिस्टेक। वनीथा, वनीथा निश कुमार 6, वनीथा हनीश कुमार, आई थिंक 5 विजिट्स इन्होंने बोला। 3 month old mentioned है बच्चों, 3 month old mentioned है। यस, जोर का झटका धीरे से लगे, मजा आ गया मुझे। सो दैट्स हाउ एग्जामिनर इज गोइंग टू ट्रिक यू, एंड दैट इज व्हाट इज गुड लर्निंग, दैट इज व्हाट इज गुड लर्निंग। I knew cesarean was 5, NVD is 6, home delivery is 7. I knew that, but this is not. अगर आपको लगता है कि आप धुरंधर हो तो आप नहीं हो। मेरे ही घर में आके मुझे ही ऐसा बोलेगा, गलत है। आशा वुड डू हाउ मेनी विजिट्स? 3 month का बच्चा है बेटा। दिस इज नॉट होम बेस्ड न्यूबॉर्न केयर, is not the correct answer. This is not home based newborn care. This is home based young child. This is home based young child, HBYC. Home based young child care. So in home based young child care, how many visits will be there? There will be 5 visits. Home based young child, there will be 5 minutes. Yes, there will be 3 monthly visits till 15 months, 5 visits, young child care. Very nice. Asha would do. वेरी नाइस। अगर सीधा ही होता तो मैं ना पूछता ना। शिवांगी एब्सोल्युटली करेक्ट। अगर इतना, इफ इट वाज सो सिंपल आई वुड नॉट हैव आस्क्ड, राइट? सो दिस इज अ होम बेस्ड यंग चाइल्ड केयर। दिस इज होम बेस्ड यंग चाइल्ड केयर। प्लीज़ नोट, डोंट टेक इट पर्सनल। मैं यहाँ पे आपको तंग करने के लिए नहीं आया। आई एम जस्ट हेल्पिंग यू डू एक्टिव लर्निंग। एक्टिव लर्निंग में जब दिमाग को झटका लगता है तो ज़्यादा मज़ा तरीके से दिमाग में घुसता है। सो होम बेस्ड यंग चाइल्ड केयर, in this is home based newborn care. You already know that normal delivery there are 6 visits, in home delivery there are 7 visits, in cesarean section there are 5 visits. You already know this for home based newborn care. It is for newborn care, right? And now talking about the home based young child care. Now talking about home based young child care. Home based young child care mein there are total 5 visits. There are total 5 visits, and visits will be 3, 6, 9, 12 and 15. Okay? असलम नहीं, अरसलान। जी भाविका सिस्टर, आप लोग अपनी बातें करते रहते हो, मुझे भी तो सुन लो भाई। मुझे किस लिए बुलाया तुम लोगों ने यूट्यूब पे? आप लोग अपनी बातें करते हो, हमें भी सुन लो। गरीब बंदा आया है कोई सुनाने के लिए। Talking about the next MCQ. In an urban slum, the community health workers does a street play to educate local population for sanitation and hygiene. The method of communication used here is demonstration, folk media, role play, gather. क्या बोलते हो? What do you want to say? In an urban slum, the community health worker does a street play to educate uh, to educate local population for hygiene and sanitation. दिस इज रोल प्ले. मुझे पता था, मतलब तुम लोग वहीं के वहीं बैठे हो क्लास में भी. यू एवरीबडी मेड द सेम मिस्टेक. राइट नाउ ऑल्सो एवरीबडी इज मेकिंग द सेम मिस्टेक. जोर का झटका धीरे से लगे. दिस इज नॉट रोल प्ले. दिस इज नॉट रोल प्ले. आओ आओ नुक्कड़ देखो, है ना. नुक्कड़ नाटक इज नॉट रोल प्ले. जोर का झटका धीरे से लगे. दिस इज नॉट रोल प्ले. वेरी नाइस. मोस्टली स्टूडेंट्स आर नाउ ऑप्टिंग ऑप्शन ए. ए भी गलत है. ले भाई, ए भी गलत है. अब क्या बचा? अब जिंदगी में बचा क्या? व्हाट डू यू वांट टू से? व्हाट डू यू वांट टू से? ए गलत है. ए इज रॉन्ग आंसर. थिंक ऑफ समथिंग एल्स. अब क्या बचेगा दुनिया में? क्या बोलोगे? गैदर बोलोगे? मज़े की बात है. मज़े की बात है. वेरी नाइस. गैदर भी गलत है. शाबाश मेरे शेरों जो लोग डी बोल रहे हैं. शाबाश मेरे शेरों. इतनी पब्लिक बैठी है, एवरीबडी आंसरिंग रॉन्ग आंसर्स. गैदर भी गलत है. व्हाट इज गैदर? गैदर, आई टोल्ड यू, वी डिस्कस दिस इन क्लास. गैदर इज GATHER. Greet, ask, tell, help, educate, and review. Gather. It is a method of communication to improve interview skills. It is when we do home visits. So gather is not for family planning. That is cafeteria is for family planning, beta. Cafeteria is for family planning. It is to improve family planning. That is, the choice of contraception is on the client, right? So gather is to improve interview skills. Gather is not the correct answer. Role play is to improve communication. Role play is to improve communication. It is a method of group discussion. It is a method of group discussion. No, not discussion. It is a method of group method. It is a group method of communication. You take a group, and in that I will become a nurse, and someone will become the patient, and will try to tell that how the nurse should be talking to the patient. That is what is a role play. I will take the role of a nurse. Demonstration is to show a skill. Demonstration is to show a skill. So folk media is what is the Nukkad Natak. Nukkad Natak, or acting, or street play. Street play. That is what is a folk media, beta. Folk media is the correct answer. Please make sure that you get this question right. So this is kind of a 5-star MCQ. This is kind of a 5-star MCQ. Right? Role play includes a group, and there is a message, or there is a way that we have to teach to people. That is what is a role play. Let's go to next MCQ. A newborn is assessed 1 minute post delivery. The heartbeat is 120 beats a minute with normal respiration. The newborn shows a strong cry and has a pink body with slightly bluish extremities. The grimace with a cry, she grimaces with a cry when the catheter is placed near the nostril or in the nostril. Her Apgar score will be, how much do you think? Her Apgar score will be 7, 8, 9, 10. What do you think? 7, 8, 9 or 10? Correct answer. Most of you are going with the correct answer. Beta, it's full marks have to be given. Full marks have to be given in this because the beats is 120 beats per minute. It is full marks, that is 2 points. I hope you all know Apgar score. Apgar score तो आपको पता होना चाहिए ना. This is what is a Apgar score. So in Apgar score, appearance of skin color, pulse, that is heart rate, grimace, that is once you stimulate the child, how much will be the grimace, the activity tone, whether the child is floppy or strong movements, and then is respiration. So because the child is, let us start from below, because the child is having normal respiratory rate, because the child is having normal respiratory rate and vigorous cry, we give full marks. The activity is strong, spontaneous, the active child is moving. The child cries with stimulation or moves with stimulation, pulls away. Yes, there is normal beats and normal body color with blue extremities. Normal body color, pink body color with blue extremities. What is the correct Apgar score over here? Anything which is more than 7 is called as a good Apgar score. And of course, here the Apgar score is 9, which is an excellent score. The Apgar score is 9, which is an excellent score over here. So this is what is the Apgar scoring, and this is what is the correct Apgar score in this particular child. Right? Yeah, because there is limb extremities are slightly bluish, acrocyanosis. So only 1 minus. Very nice. So that is the only negative over here. Please remember, correct answer beta has a pink body with a slightly bluish extremities. That is the only one negative over here. Very good. Let's go to the next one. In an urban slum, large number of typhoid cases are reported from last 2-3 months. Right? The time trend chart with the number of cases shows initial clustering of cases, then multiple smaller peaks at regular intervals, multiple smaller peaks at intervals during the same outbreak. The typhoid cases show higher endemic levels. Which would best describe this? So, what do you think? Which would best describe this? Point epidemic, common source epidemic, multiple exposures, seasonal epidemic, propagated epidemic. Say, absolutely correct. I think most of you are answering this correctly. This says because there are multiple peaks at intervals. This is the correct answer over here is common source multiple exposure epidemic. That is the correct answer. Very nice. Very nice. Correct answer. Very good. So this is what is a point source epidemic, where there is a single peak and a single rise and fall. All the cases will be within one incubation period. All cases within one incubation period, there is rapid rise, rapid fall. If there is a rise and then there is a continuous endemic, there is high endemic. High endemic, then the answer, this is a continuous source or multiple exposures. Multiple exposures from a same source. Okay. Propagated will be one wave, then after some time second wave, then third wave, then fourth wave, like this. So propagated will be when there is person to person transmission. If there is a person to person transmission, this is propagated transmission. That is what is the correct answer. Over here it's a direct question, direct answer, nothing much. Next MCQ, in quality of life years, QALY, utility weights are assigned to represent health related quality. Which of the following correctly describes the standard utility scale? It's not very, very important, but yeah, someone might ask you this. If you know it, very good. Yeah, I think it's there in your test also. So this is the correct answer is 0 is death and 1 is taken as a perfect health. 0 is death and 1 is taken as a perfect health. This is what is a standard utility scale for the QALY. So it's just factual question, direct to remember, nothing much. Let's go to next MCQ. Which of the following statement is correct for health and development indicators? Try करो इसको आंसर करने का. Which of the following statement is correct for health and development indicators? Okay, which of the following is correct? Okay, most of you are going with the option D. This question is a 10-star MCQ, frequently asked in your exam. Make sure that you study everything regarding what is GHI, PQLI, HDI. You have to know everything regarding GHI, PQLI, HDI. So ये सब चीज़ें आपको आनी चाहिए. Most of you are going D. Some are saying C also. Okay. Okay. So talking about first answer, that is PQLI. What is PQLI? PQLI, beta, it takes into account three things. It will take into account three things. Life expectancy at 1 year. It will take into account literacy rate. And it will take infant mortality rate. Okay. Next in line, what is HDI? Next in line, what is HDI? So we talked about PQLI, that is life expectancy at 1 year, literacy rate, and it also takes infant mortality rate, right? Next in line we have is HDI. What does HDI? It takes life expectancy at birth. Then it takes two things, that is expected school years and mean school years. And instead of infant mortality, it will take the income per capita. Income per capita. This is based on the GNI, that is the gross national income. Next in line we have is the GHI. GHI, beta, it will take into account under 5 mortality rate. It will take into account malnutrition. Malnutrition in terms of stunting and wasting, and it will also take into account inadequate food supply, that is both adult and child malnourishment. This is what is a 10-star MCQ frequently asked in your exam. You have to memorize each and every indicator over here. This has been asked multiple times in your exam. Make sure you take a screenshot and you try to remember. If you want a written table, this is what is a flashcard which will look like. You have to remember what is PQLI, what is HDI, what is GHI, MPI if you want. MPI, beta, if you want, you can just skip out MPI. It's not so much required. But yes, this is all our 5-star MCQs, 5-star MCQs, 5-star MCQs. Everything you should be knowing over here. Everything you should be knowing over here. What are the indicators? What is the current level of all these things? Right? So now if you understand all this, let us come back to the MCQ. Now if you understand all this, let us come back to the MCQ. So in this question, they are talking about infant mortality is accounted in GHI. Is it correct? This is wrong answer. Infant mortality is not accounted in GHI. We take under 5 mortality rate. So this is a false answer. This is false, right? We don't take infant mortality. Infant mortality is used in PQLI. Under 5 mortality is accounted in PQLI. No, this is wrong answer. Under 5 mortality is accounted in GHI. Just now we did. So this is also a false answer. SAM child. What is SAM child? Severe acute malnutrition with weight for age less than -3 is accounted in GHI. This is also false because we do not take -3 SD. We take -2 SD as acute malnutrition. That is what I had written as stunting and wasting. When do you say stunted and when do you say wasted? When it is less than -2 SD. Weight for age, weight for height, right? Right? So this is what is again a false answer. Gross national income is used in HDI. That is the only thing which is the correct answer. And of course, this is the only one which is the single best answer for you guys to mark in your exam. Okay. So please tell in changes in TFR and contraceptive and also contraceptive implants. Beta, tube light, your name is funny, but yeah, tube light, beta, आपको थोड़ा सा अभी और ट्यूबलाइट की तरह जगो and we'll talk about these. Your name is funny guy. So yeah, tubelight. Please tell these topics in the last. When I'll finish the whole lecture, that time you let me know the topics again. तो यार आपका असली नाम अच्छा होगा, ऐसा ट्यूबलाइट क्यों लिखते हो यार अपना नाम. So please note the option D is the best one for you guys to mark. Which of the following statement is not correct for NVBDCP? ये करंट डेटा है, GHI लिखा तो हुआ है यार, तुम्हें क्या चाहिए? करंट लेवल्स लिखा तो हुआ है, यू नीड टू बी थोड़ा बहुत सेल्फ अवेयर व्हाट इज रिटन. ओके, ट्यूबलाइट वाले काम हो गए. विच ऑफ द फॉलोइंग स्टेटमेंट इज नॉट करेक्ट फॉर NVBDCP? Late evening fogging and outdoor sprays are most effective for stopping dengue epidemics. 3 drugs are given annually to prevent lymphatic filariasis. Killed vaccine is used to prevent JE in endemic districts. Longest flight range is for Culex mosquito. Which of the following statement you think is not correct in NVBDCP? Okay, most of you are going with option A. Some are saying option C as well. Okay, so this is again a 5-star MCQ beta. 5-star MCQ frequently asked in your exam. This is again a 5-star MCQ frequently asked in your exam regarding NVBDCP. So mostly students are saying option A or C. Let us have a quick discussion about the options. So I'll start from below. Longest flight range is for Culex mosquito. Yes, this is correct answer. Culex mosquito, longest flight range is for Culex. It is roughly 10 to 13 kilometers. And the short flight range is for Aedes, which is only 200 to 300 meters. 100 to 300 meters. It is only for 200 to 300 meters, right? Now, killed vaccine is used to prevent JE. To prevent JE, there are 2 vaccines. We have a live vaccine and we have a killed vaccine. Old answer was live vaccine. New answer, updated answer, that is a killed vaccine. It is given as 0.5 ml intramuscular vaccine in the left anterolateral thigh. It is given as 0.5 ml in the left anterolateral thigh. It is a Kola strain vaccine. Very nice. Very nice. 3 drugs are given twice annually to prevent lymphatic filariasis. This is what we call, this is also a correct answer. This is what we call as MDA, mass drug administration. This is what we call as mass drug administration. How many drugs we are giving? We give ivermectin, DEC, albendazole. Ivermectin, DEC, and albendazole. These are the 3 drugs which are given biannually. They are given twice annually. They are given on 10th of February and 10th of August every year. They are given on 10th of February and 10th of August every year biannually. Late evening fogging is most effective for stopping dengue epidemics. No, this is wrong answer because the dengue mosquito, it is transmitted by Aedes. Aedes is mostly indoors. And outdoor fogging, late evening outdoor sprays are most effective. This is wrong answer. It is mostly indoors and therefore late evening outdoor spray is not useful. Indoor spray may be useful, and that too, Aedes is predominantly daytime biter. What do you mean by daytime? That is 2 hours after sunrise and 2 hours before sunset. This is the peak time of biting of the Aedes mosquito, 2 hours after sunrise and 2 hours before sunset. This is called as the daytime biter. This is late evening fogging is most effective for stopping the dengue mosquito or dengue epidemics. That is the wrong answer over here. So Aedes is, yes, lazy mosquito. It stays inside the house, drinks your water. You remember, drinks your water. It stays within the house. And वो yoga करके दिखाएगा. It will drink cigarette. It will smoke cigarette in front of us. Cigar shape. Eggs will be there. Shameless, fearless tiger mosquito. Absolutely correct. It is a painful bite. Very nice. All those who remember it. So what is the best answer for you guys to mark over here? The best answer for us to mark over here is late evening fogging are most effective, they are not effective. Option A is the best one for you guys to mark. Good. Let's go to the next MCQ. In field setting, the screening test of choice is very important. Which of the following is not correct screening test of choice in field or community setting? Which of the following is not the correct answer? What do you think is the best answer? Okay, someone saying C, someone saying A, C. Okay, C, 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 C. Anishka says C. So pap smear for cervical cancer, HRP2 rapid test for malaria, fasting blood glucose for diabetes mellitus, one-step glucose, one-step OGTT for gestational diabetes mellitus. Okay, very nice. जोर का झटका धीरे से लगे. Again, googly question for you guys. Which is not correct screening test of choice? Not correct बताना है. Please remember screening test of choice in for diabetes mellitus. Let us just start. चलो नीचे से शुरू होते हैं. So one step OGTT for gestational diabetes mellitus. This is a true answer. It is not two step. This is a correct answer. It is true answer. It is one step OGTT is done. It is done. As the female will come, we will give her 75 grams of anhydrous glucose and we test it after 2 hours. So 2 hours post glucose load. Post glucose load, we are going to test the blood sugar, and that is what we call as one step testing. This is a true answer. Okay. Fasting blood glucose for diabetes mellitus. This is also true answer, beta. For diabetes mellitus, there are two tests which we can do: a fasting blood glucose, or we can do a postprandial blood glucose. I understand that HbA1c, that is the best answer. That is the best answer. But HbA1c is not available. It is not available in the field setting. It is not available in the community or the field setting. HbA1c is not available. What is the single best parameter on which we can rely and screen for diabetes mellitus? The best parameters is fasting blood glucose. Next is HRP2 rapid test for malaria. Yes, this is also a true answer. For malaria, beta, for malaria, rapid diagnostic tests are available. For malaria, rapid diagnostic tests are available. They are based on LDH, lactate dehydrogenase level. This is species specific. We can also use a Plasmodium falciparum, HRP, histidine rich protein 2, HRP2 protein estimation. We can also do Plasmodia aldolase antigen. Aldolase antigen is not used in India. It is not used in India. In India, we are either using LDH or HRP2. HRP2 is most commonly available. In malaria, beta, we are doing rapid diagnostic test is done using both strains. That is for dual, that is for Plasmodium vivax and for Plasmodium falciparum. The both strain will be there, and we do the HRP2 and the LDH, both antigens will be tested, rapid diagnostic test, right? So this HRP2 is again true. Obviously, common sense answer, pap smear for cervical cancer, that is not possible in the field setting. How can you do pap smear in a field setting? So please note the correct test answer over here for cervical cancer. It is visual inspection with acetic acid, 5% acetic acid visual inspection. That is the correct answer. And I think ma'am must have also told you, Sakshi ma'am must have talked about this in your midwifery lectures or in gynae lectures, that cervical cancer, the investigation of choice in field setting, it is VIA, visual inspection with the acetic acid. So obviously that is your correct answer to be marked option A, that is pap smear. Let's go to the next MCQ. Which of the following is not correct for latest trend of demographic indicators? Which of the following is correct answer for this. Not correct for the latest trend. MMR is 88 per 1000 live births. Leprosy prevalence is 0.45 per 10,000 population. Under 5 is 29 per 1000 live births. TFR is 1.9. वही तो she would kill you now, Jasvi. एब्सोल्युटली, मतलब वो नहीं कुछ तुम्हें बोलेंगे तो मैं बोलूँगा इतना दफ़ा तुम्हें सबने पढ़ाया, मैंने भी पढ़ाया, मैम ने भी पढ़ाया. सो दिस इज़ इम्पॉर्टेंट अबाउट सर्वाइकल कैंसर पैप स्मीयर. So very nice. Most of you are going with option B. Very good. Option B. Leprosy prevalence. Leprosy prevalence. Under 5 is 25. No. Very good. Very good. So most of you are going with option A, option B. TFR is 1.9. ऑब्वियसली वेरी गुड. सो वही कहानी है, जोर का झटका धीरे से लगे. जिन बच्चों ने, all the students who could understand this question nicely, they have understood it and they know that common sense answer over here. MMR is 88 per 1000 live births. Who will agree to you, beta? This is such a stupid MCQ. This is not per 1000 live births. It is per lakh live births. Common sense. क्या पढ़ते हो तुम लोग ना? क्या पढ़ते हो तुम लोग? So this is MMR is 88 per lakh live births. MMR is 88 per lakh live births. Leprosy prevalence is 0.45. That is true answer. Leprosy prevalence is 0.45. That is true answer. Under 5 mortality is 29 per 1000 live births. That is also true. TFR is 1.9. That is also true. The current TFR in our country, that is 1.9. So ये silly mistake है, जल्दबाजी. Please note MMR is 88 per lakh live birth. MMR is 88 per lakh live births. A very quick review about all the updates that we have. Please remember that the birth rate in India is 18.4. The death rate in India is 6.4. Infant mortality is 25. Neonatal mortality 19, and under 5 mortality is 29. Under 5 mortality is 29. Maternal mortality ratio is 88. Please remember it is per lakh live births. And what is MMR? MMR is MMR. It is MMR. It is maternal mortality ratio. Please remember it's a ratio. It's a maternal mortality ratio. And then you can remember the sex ratio at birth. You can remember this number. It is 917. The sex ratio at birth is 917. Okay. So please note, ये छोटी छोटी mistakes आपसे silly mistakes नहीं होनी चाहिए. So sir, pre में बहुत से question direct आए थे आपके बताया. Thank you very much. And I just hope के mains में भी also you will get all the MCQs in your the same pattern what we have studied, and only if you have studied. Chalo, very nice. So please make sure that you remember this SRS update. It is very, very important. Very, very important. एंड एक दफ़ा तो गलती होगी, अभी कर लो एग्ज़ाम से पहले तो अच्छी बात है, एग्ज़ाम में करोगे तो गलत बात हो जाएगा. सो दैट्स व्हाट आई एम हेल्पिंग यू डू इट. So coming to the next MCQ regarding the progesterone injection for contraception, all are correct except. Coming to contraception, one of the student was asking again and again about contraceptions. So regarding progesterone injection for contraception, all are correct statement except you have to find the wrong one. Antara is given 150 milligram injection 3 monthly. Antara can be given 1 month after the missed injection. Cyanopress is given 104 mg subcutaneous injection. Antara can be given anytime after delivery in breastfeeding females. What do you want to say? That was such a funny question, beta. Dev Patel. Why do you ask such मतलब ऐसा topic? Sir, current data use करना है या previous मतलब why do you want to answer previous data? मतलब does it have any logic right now? Current exam दे रहे हो तो current ही answer करोगे. Why would you answer old answer? So, what do you think is the best answer over here? Most of you are going with option D, which is the correct answer. Antra can be given, beta. Antra, it is a 5-star MCQ frequently asked in your exam. Antra is a 5-star MCQ frequently asked in your exam. Let us just have a quick discussion about the option. Antra is given as 150 milligram IM injection 3 monthly. Yes, this is true answer. It is 150 milligram IM injection given every 90 days. It is 3 months. The problem is that the return of fertility after taking Antra injections, is usually 6 to 7 months. So that is what it is. It is 6 to 7 months. Next is Antra can be given 1 month of injection. Yes, this is also true. If there is the due date of Antra, then it can be given 2 weeks before. It can be given till 4 weeks later on also. Cyanopress is given as 104 milligram subcutaneous. This is also true answer, beta. It is given as, this is what is a sub-Q Provera, which is a 104 milligram subcutaneous injection. It is also given 3 monthly. But under the Government of India program, we are using only Antra. Antra is given in Government of India. Okay. Antra can be given anytime. No, this is false answer. Why? Because after delivery, if the female is breastfeeding, Antra can be given after 6 weeks. And in case of non-breastfeeding, it can be given anytime. It can be given anytime in case of non-breastfeeding. In case of breastfeeding female, it has to be given only after 6 months. It has to only after 6 weeks, not months. So, which is the correct answer for you guys to mark? Obviously, for us to mark over here, Antra can be given anytime. That is the only MCQ which is kind of a wrong answer over here. Okay, let's try this one. Something more important. Let's try this one. Hemoglobin levels were compared for 500 individuals in 2 separate villages. Individuals from one village received IFA tablets, while another village received nutritional counseling and nutritional supplements, natural supplements. The test of significance which can be used is. The test of significance which can be used over here is. What do you think is the best answer? Okay, so most of you are going with option D again, chi-square test. Okay, good. Most of you are going with option D. There was one student who answered A also, C also, ANOVA. Very nice. जोर का झटका फिर से धीरे से लगे, फिर से आप लोगों ने वही काम किया, गलत किया आंसर. गलत हो गया आंसर. इट इज नॉट डी बेटा. डी इज इनकरेक्ट आंसर. D is incorrect answer. This I told you multiple times in your class also, in the classes when we conducted the classes. At that time we had a word on this multiple times that there will be a question on test of significance. Test of significance, it is almost a 10-star important topic. Every year they will ask you one question on test of significance. In test of significance, beta, you always will have to find out whether it is a parametric test or a non-parametric test you will apply. When will you use a parametric? When there is the data is quantitative. And when will you use non-parametric? If the data is qualitative. In case of single group, we will use a paired t-test, that is before after. In two groups, we will use unpaired t-test or independent sample t-test. Three groups is analysis of variance for quantitative data. In case of qualitative data, the best answer, any answer, it could be chi-square test. Single best answer is chi-square. So in this question, you just have to think about two things, that what is the type of data, and then you have to find out how many groups are there. That's it. So what is the type of data, beta? Type of data, this data, we are talking about hemoglobin levels. We are talking about HB levels, na? So we are talking about hemoglobin levels. So hemoglobin level, what is hemoglobin? Is it a quantitative or a qualitative? Technically, it is a quantitative data. Very good. So it is a quantitative data. So common sense, which test of significance are you going to apply? It has to be paired, unpaired, or ANOVA test. It cannot be chi-square. Chi-square is a wrong answer, because this test, this data is a quantitative data. Next in line, so this is a quantitative data. How many groups do we have? There are two groups. Why do you say there are two groups? Because there are two separate villages. Simple. So because there are two groups, quantitative, the best answer over here is independent sample t-test. So very, very simple question. I don't know why many people get confused. It is unnecessary. You are going to get, beta, ये question आएगा ही आएगा, ऐसा ही question आएगा. आपको दो ही चीज़ें देखनी है. You have to find out type of data and you have to find out the number of groups. That's it. And make sure you practice upon finding what is the type of data, quantitative data, qualitative data. This is ultra important for you. How to find out the type of data. This is a 5-star important MCQ for you. You have to find out what are the different types of data. Okay. Make sure that you study about different types of data. Coming to next one, randomization is not useful in. What do you think? Randomization will not be useful in. What do you think? Randomization will not be useful in. Yeah. Preventive trials, cessation experiments, risk factor trials, pre-post study design. Absolutely. Very nice. So randomization is not useful in. Obvious answer, pre-post trials. Randomization is not useful in pre-post study designs. But if you talk about the experimental studies, experimental trials, the experimental trials, we can have clinical trials, preventive trials, cessation experiments, all are randomized trials. We can also have before after trials or natural experiments. These are always non-randomized trials. So it's a direct question, direct answer. Which of the following is randomized? Which of the following is non-randomized? Common sense, before after trial. That is the other name for pre-post study design. Pre-post. Pre means before and post means after. So we discussed this also in the class, pre-post study design. Right? So beta, many students are asking me about this, what is a quantitative data, what is a qualitative. This we have discussed, ये बहुत दफ़ा हमने classes में बात किया है. What is a quantitative and what is a qualitative. Qualitative data, quantitative is hemoglobin, where you are measuring it. Measure करते हैं जब आप. And qualitative will be like anemia, percentage of anemia, when you count the things. Whenever the data will be in percentage, remember percentage will always be a qualitative data. अगर आप उसमें mean निकाल पाएं, average निकाल पाएं, it will be a quantitative data. So please remember that quantitative and qualitative, it is a 10-star, 100-star MCQ, frequently asked in your exam. Many questions will be based on whether the data is a quantitative data or the data is a qualitative data. It is asked multiple times in your exam. Very nice. Height, weight, HB, sodium, potassium. Very nice, Shivangi. That is what we discussed in the classes also. Coming to next one. Which of the following statement is not correct? Question from epidemiology. Which of the following statement is not correct? Incidence can be calculated in a cohort study. Prevalence is found in a cross-sectional study. Study of choice for rare exposure is a case control study. Longitudinal studies are cause to effect studies. Which one do you think is not correct? गलत वाला बताना है तुमको. You have to tell the false one. Which of the following statement is not correct? Incidence is found in cohort studies. What do you want to say about these options? Okay, so most of you are going with C and D. C and D, okay. Just two beta. Okay. C and D, C and D. Okay, very good. Just to have a quick discussion about these options first. So which of the following statement is not correct? Okay. Incidence is found in cohort studies. These are long-term studies. These are longitudinal studies. These are also known as longitudinal studies. And incidence is found. This is a true answer. Prevalence is found in cross-section study. This is also true answer, beta. Prevalence is found in a cross-section study where you do a cross-section. Study of choice for rare exposure is a case control study. This is a wrong answer. It is not a case control rare exposure. Rare exposure is not a case control. It is a cohort study. Rare exposure is a cohort study. Please remember, rare disease agar aa jaye, if you get the option as rare disease, the best answer is a case control study. But if it is a rare exposure, then the answer has to be a cohort study. So option C is your best answer, which is the wrong answer. Many students got confused that longitudinal studies are cause to effect study. Absolutely, longitudinal study is what is the other name is what is we call as a cohort study. So they go from cause to the effect. They go from risk factor to the disease. This is the correct answer. It is a true answer. So obviously option D is the correct answer. So don't do these mistakes. These are very silly mistakes. I already knew that you guys must be knowing the answer, but intentionally I just made the question tricky so that many of you might be falling for longitudinal studies. They'll think that probably they'll be cross-section study or case control. There is a 5-star table which I have made, and it is also there in all the workbooks. All those who attended the classes in Nursing Next Live, I have given this table as a summary table for total epidemiology. I've given this as a summary table. This is a 5-star table. The frequently asked MCQs on cross-section study, ecological, case control, and cohort. So remember that rare disease, the best study is a case control study. Rare risk factor, the best study is a cohort study. Okay. Effect to cause, cause to effect, all these are direct question, direct answer. Make sure you study this whole table. One MCQ is almost guaranteed from this table. It's frequently coming in your exam. And make sure कि इसको बार-बार पढ़ के जाना है. Okay. Chalo, let's go to the next MCQ. I think many of you must be knowing about this MCQ. You know how to solve this question. Drug of choice for prophylaxis of HIV in a child born to HIV positive female who is on ART since last 1 year with viral load of 1500 copies and is planning to have a replacement feed is. What do you want to say? Nevirapine for 6 weeks, nevirapine for 12 weeks, nevirapine plus zidovudine for 6 weeks, or nevirapine zidovudine for 12 weeks. I think you all must be knowing the answer for this. So this question has been taught much in detail by Anand sir, by Dr. Anand, and You should be able to answer this question. Direct question, direct answer है. This should not be done wrong by. Yeah, I think most of you are answering correctly. Very nice. All those who know it, they know it. So, very good. Very good. So, beta, you should be knowing that how to manage a child who is exposed to HIV. So, we can have two types of risk status: low risk infant or high risk infant. Low risk infant is where the mother is having viral load is less than 1000 copies. Where the viral load is less than 1000 copies, that is what we call as a low risk infant. Viral load is less than 1000 copies anytime in the mother. Okay. When do we call high risk? High risk is when the viral load is more than 1000 copies. Viral load is more than 1000 copies. So if you understand this, यहाँ पे what is a viral load, beta? Viral load is 1500 copies. So it is obviously more than 1000 viral load, and the female is taking ART since 1 year. That is irrespective of the point. So what is this? What is the transmission? It is a high risk of transmission. Because it is high risk of transmission, beta, what is the drug of choice for high risk of transmission? We have to give exclusively breastfed infants will be given 12 weeks. Exclusively breastfed children will be given for 12 weeks, and exclusive replacement children will be given for 6 weeks. What is the regime? Nevirapine plus zidovudine. So nevirapine zidovudine to be given for 6 weeks. That is the best answer in this question. And option C, most of you were answering option C only. That is the correct answer. That is the only thing which is the true answer over here. That is the only thing which is the true answer over here. Very nice. Good. So if you have done the MCQ correctly, most of you answered correctly. Very good. Which of the following is not a drug of choice for prophylaxis of public health condition? Just 5-6 questions more, and I think you all also must be tired for now. थक गए कि नहीं? What do you think? थक गए कि नहीं थके? अभी तक क्या प्रोग्राम है तुम लोगों का? Are you guys tired? Are you guys tired? What do you think? Very nice. नहीं सर, अभी कहाँ tired? थकना हमारा काम नहीं है. I thought you must be getting bored also. बोर तो नहीं हो रहे तुम लोग? अगर बोर हो रहे हो तो we can wrap up the session very quickly. I just made these MCQs, right? हिंदी में बोलते हैं. So in Hindi we say it. I know there are some students who won't understand Hindi as such, but just a few points like कि अभी कुछ शेष बाकी है मुझ में, कि सब कुछ हारा नहीं हूँ मैं. अभी कुछ शेष बाकी है मुझ में, कि सब कुछ हारा नहीं हूँ मैं. मुझको भी चमकना है एक दिन, भले ही सितारा नहीं हूँ मैं. और मेरे अंदर भी रहता है पिरवा अभी, भले ही जल की धारा नहीं हूँ मैं. और मैं किस्मत को दोष नहीं देता, क्योंकि किस्मत का मारा नहीं हूँ मैं. है ना? सो ये तो आई थिंक एवरीबडी नोज अबाउट इट कि जख्मी तो यहाँ हर परिंदा है, लेकिन जो फिर से उड़ गया वही तो जिंदा है. So everybody I know is tired, everybody is fatigued out, सबको everybody feels like मेरे को ये सब भूल जाता है, keep on forgetting again and again. But if you keep on forgetting again and again, which is a very good sign. अगर तुम भूलते हो ना तो it is very good. और अगर तुम थकते हो that means you are struggling for it. अगर तुम थके ही नहीं हो, मतलब थकेगा कौन नहीं, जो पढ़ेगा वो थकेगा ज़रूर. एंड थकना बड़ा ज़रूरी है. एंड यू शुड गेट दैट फियर. वो डर आना बड़ा ज़रूरी है, बिकॉज वो डर आएगा तभी तो एग्ज़ाम के लिए वी विल बी प्रिपेयरिंग वेरी नाइसली. है ना? सो वो कहानी पूरी करता हूँ। जख्मी तो यहाँ हर परिंदा है, लेकिन जो फिर से उड़ गया वही तो जिंदा है। मुझे दो दो इतनी उलझने कि जीतने में जान लग जाए, है ना। मुझे दो इतनी उलझने कि जीतने में जान लग जाए, पर जब जीत लिखूं तो आसमान लगे। ये मज़ा तो तब है जब जीत लिखूं तो पूरा आसमान लगे। एंड दैट इज़ व्हाट वी ऑल आर लाइक स्ट्राइविंग फॉर, दैट वेन एवर वी विल राइट विक्ट्री, वी विल राइट विद प्राउड that yes, we are victorious and we have earned this victory. No one will stand in front of us. So you all have to be standing like warriors. So yeah, this only YouTube platform is for other states. Keep continuing English. Yeah, of course the whole session is in English, but there are some things which because I belong to a Hindi speaking or Punjabi speaking state, I come from Punjab, and in Punjab, we always say that we don't stop when we are tired. We only stop when the work is done. And you guys are going to work until you all succeed in your NORCET final mains exam as well. So, chalo, which of the following is not correct choice for prophylaxis of public health condition? हिंदी नहीं मालूम, नसीब एके। तो हिंदी में लिखा क्यों नसीब एके? दैट वाज सो स्वीट ऑफ यू। हिंदी नहीं मालूम और वो हिंदी में लिखा। वेरी नाइस, वेरी नाइस। सो या, ऑफ कोर्स द होल सेशन लेक्चर विल बी इन इंग्लिश बेटा, बट in Kashmiri we say pashro khudayas. Very nice, pashro khudayas, है ना? वारे असल चो, वारे असल। Which of the following is not correct drug of choice for prophylaxis of public health condition? Option is A, B, C or D. Correct answer, everybody correctly saying that Dapsone is for treatment of leprosy and Dapsone is not used for prophylaxis. What is the drug of choice for leprosy? Dapsone is not the drug of choice for leprosy prevention. The drug of choice for prevention of leprosy is single dose rifampicin. The drug of choice is single dose rifampicin. Single dose rifampicin, right? सर हिंदी में समझाओ बेटा, कहाँ कहाँ जाऊँ मैं? So single dose rifampicin is for leprosy. Please note that just now we did mass drug administration for lymphatic filariasis. This is a true answer. INH and rifampicin is to be given for tuberculosis. For TB prevention, beta, there are two regimes. We can give 6 months of isoniazid. We can also have 3 months of H and P. This 3 months of H and P is given as weekly tablets, weekly doses, and 6H is given as daily doses. So that is for TB prevention. Then is tenofovir, lamivudine and dolutegravir for HIV. Yes, this is correct. We give TLD for 28 days. And this has to be started within 72 hours of exposure to the needle stick injury, and best started within 2 hours. It is best given within 2 hours, but finally it should be given within 72 hours. So what is the single best answer you would like to mark over here? Dapsone for leprosy. That is your single best answer over here. Right? Chalo. Another MCQ, which of the following is not a correct target for National Health Program? Which of the following is not correct target for National Health Program? What do you want to say? What do you want to say? Which of the following is not a correct target for National Health Program? Just 4-5 MCQs. That's it. Last tail is pending. That's it. Which of the following is not a correct target? Absolutely correct. API. Now in this, I don't have anything to teach. You already know all the targets, and if you don't know, you need to study all the targets. API less than 1 per 1000. That is a correct answer. This is a true answer. Leprosy prevalent should be less than 1 per 10,000. This is also true answer. ABER is less than 10. That is wrong answer. ABER should be more than 10%. It is not less than 10%. So obviously option C is the single best answer. Blindness rate of less than 0.25, that is also correct answer. So very nice. I think most of you already must be knowing this. Next MCQ. This is, let us see if you can solve this. Let us see if you can solve this. I'll be back in just a moment. Try solving it. Try solving it. I'll be back in just one moment. So, isme, I think most of you are giving what answers? Most of you are giving C and B, more than 10, more than 10. Okay. क्या बोलते हो इसमें? B. Okay. C. Okay. 10 lakh ka 80,000, that is 80,000 B. Most of you are going with option B and C. जो मुझे समझ में आया है कि आप सब लोग ऑप्शन B और C के साथ जाना चाह रहे हो. Well, 16 is nearer, I think. अच्छा, किसी का 16 भी आया है. चलो. Anyways, coming to this MCQ, beta, a city has a population of 10 lakh with 20% residing in the slum area. The पूरी गेम का जो गेम पॉइंट है वो तुम लोगों ने ध्यान नहीं दिया. गेम पॉइंट जो है, जिन लोगों ने ध्यान दिया दे नो इट दैट वो जो क्वेश्चन है वो 20% रिजाइडिंग इन स्लम एरिया की बात हो रही है. ओके, so the estimated number you need to find out. You are a chief nursing officer and you are supposed to advise के how many urban PHC लगनी है यहाँ पे. तो यहाँ पे you are talking about the UPHC, urban PHC. You already know that urban CHC is for how much population, beta? It is for 2.5 lakh population. You already know urban PHC is for how much population? 50,000. A&M center is for 10,000 population. Asha Usha workers, they are for 1,000 to 2,500 population. Right? So now we come to this point that 20% are residing in slum areas. तो ये जो urban PHC है ना, urban PHC, it is only in slum areas. It is only in the slum areas. It is mostly for slum areas. It is not for posh areas. So people who are living in very high profile areas, they are not going to, who is going to visit for your PHC? अगर कोई बहुत अमीर लोग हैं, आपको लगता है कि वो PHC आते होंगे हमारे, वो कोई देखता भी नहीं है हमारी PHC की तरफ. सो PHC कौन आएगा बेटा? जो झुग्गी झोपड़ियाँ हैं जहाँ पे people who are living in slum areas, they'll be visiting our PHCs. So in posh locality, they'll not come for the PHC. So 10 lakh population है. In 10 lakh population, 20% are residing in slum areas. That is 2 lakh population is there in slum areas. So you know that 50,000 is for one urban PHC. So for 2 lakh में कितनी PHC? What is the best answer? What do you guys want to say? So what do you guys want to say? मतलब उल्टा करने का हमने जिम्मेवारी कर रखा है. इज इट योर रिस्पॉन्सिबिलिटी टू मार्क द रॉन्ग आंसर? बेटा एग्जाम में ट्राई टू मार्क द राइट आंसर, डोंट मार्क द रॉन्ग आंसर. सो वेरी नाइस. So how many PHCs will be there? Roughly 4 to 5 PHCs will be there. The correct answer is option A, that is 4 to 5. ये विजेता हूँ मैं. So please note it is option A. ए भाई साहब, अभी भी someone is saying option C. How can you do that to me? Mahira. That's what, na? It's option A. It's pretty simple, option A. Okay? It's a very simple option A. Coming to next MCQ. Which of the following is not a correct match? Try answering this. What do you think is the correct match? Sub-center upgraded to Ayushman Arogya Mandir. PHCs upgraded to polyclinics. CHCs is upgraded to FRUs. Block hospital upgraded to sub-district hospitals. So which of the following is not a correct match? Sub-center upgraded to Ayushman Arogya Mandir. PHC to polyclinics, CHC to FRUs, block hospital to sub-district hospital. Which is not a correct match. आपको गलत वाला ढूंढना है. अब ये तो यार, ये तो easy है. अब ये तो easy MCQ है. What do you think? Mostly students are going with option B and D. B and D and C also. Okay. ये कौन अभी आया? खुशित अनवर. Good evening, good morning हो गया बेटा अब तो. It's almost ending of the class. So sub-center upgraded to Ayushman Arogya Mandir. This is a true answer. It is a true answer. Sub-centers are upgraded to Ayushman Arogya Mandir. PHCs are upgraded to polyclinics. Polyclinics, please remember, are for 2.5 lakh population, roughly 2 lakh population. It is there in urban areas. Urban areas mein we have polyclinics, upgraded PHCs, that is polyclinics. CHC is upgraded to FRU. Yes, that is correct. FRU is for 24/7 blood bank facilities. Blood bank facilities, and this is for emergency obstetric care. It is for emergency obstetric care. Block hospital upgraded to sub-district. No, they are the same word. Block hospitals also called as sub-district hospitals. It is the same word. So it is the same word. Option D is obviously the only one which is a wrong answer over here. Option D is not upgraded to sub-district. Option D is the block hospital is the other name for the sub-district hospital. So ये तो उसका दूसरा नाम है, ये तो upgradation है ही नहीं है. CHCs को upgrade करेंगे and PHC को अपग्रेड करेंगे पॉलीक्लिनिक्स में, सब सेंटर्स विल बी अपग्रेडेड टू आयुष्मान आरोग्य मंदिर. सो आई थिंक दैट्स अ डायरेक्ट क्वेश्चन, डायरेक्ट आंसर. कमिंग टू नेक्स्ट वन. Which of the following is not correct for water purification? Which of the following is not correct for water purification? What do you think? MPW will have responsibility to check for water chlorination. Free chlorine levels should be more than 0.5 with a minimum contact of 30 minutes. Horrocks apparatus will help to estimate chlorine levels in water. Water purification is done in sand bed in a rapid sand filter. Which is not correct for water purification? What do you think is not correct for water purification? Most of you are going with option D. Some are saying option B also. Some are saying option C also. Most of you are going with मतलब mixed response है. चमन पलिया, C को लॉक कर दिया जाए. Very nice. I like that attitude. C को लॉक कर दिया जाए. तरीके से टनाटन C को लॉक करेंगे. And absolutely correct बेटा. C is the correct answer on this question. Because that is wrong answer. So if you talk about the MPWs, MPWs will have responsibility. This is true answer. Everybody knows this. MPW male is going to check for the water quality. I don't know why. पता नहीं क्यों, मतलब just because वैसे ही मुझे I think just because you wanted to irritate me or disturb me, and that's the reason people answer option B. Option B is obviously true beta. Free chlorine level should be more than 0.5% with a 0.5 parts per million with a minimum contact time of 30 minutes. Horrocks apparatus will help to estimate chlorine level. No, this is not to estimate the chlorine levels. It is to find the chlorine demand. Chlorine demand in water, that how much chlorine is required to be put in water. That is what is the use of Horrocks apparatus. This could be image based question beta. So image based question. सर हमारी कोचिंग में इन टॉपिक्स के नहीं है. Who says तुम्हारी कोचिंग में इन टॉपिक्स के नहीं है? इनफैक्ट नर्सिंग ऑफिसर्स आर सपोज टू कंडक्ट हॉरॉक्स टेस्ट. बेटा नर्सिंग क्लासेस में व्हेन यू आर डूइंग योर नर्सिंग यूजी, एट दैट टाइम वी यूज टू टीच हॉरॉक्स अपरेटस. हॉरॉक्स हमारे कोर्स में नहीं है, ये अलग ही दुनिया से आया है. So Horrocks apparatus beta, what is Horrocks apparatus? Horrocks apparatus will be the amount of bleaching powder. It is the amount of bleaching powder required to disinfect 455 liters of water with a minimum contact time of 30 minutes. This is what is Horrocks apparatus. This is what is Horrocks apparatus. This is what is Horrocks apparatus. Horrocks apparatus बेटा कोचिंग में लिया कि नहीं लिया? तुम कोचिंग करके आए हो कहीं से या फिर नर्सिंग करके आए हो भाई साहब? नर्सिंग करी होगी यार. यू मस्ट बी. So yeah, in second year in community health nursing, Horrocks apparatus is an important aspect beta. Horrocks apparatus will tell you the amount of bleaching powder to disinfect 455 liters of water. That is what is the use of Horrocks apparatus. The main purification is done in the sand bed. Obviously this is true answer. Main purification is done in the sand bed. Okay, chalo next MCQ. Match list 1 with list 2. What do you think? Match list 1 with list 2. Coming back to the national health programs. बताओ जी. List 1 में options are PM समग्र स्वास्थ्य मिशन, स्वास्थ्य सुरक्षा योजना, वय वंदना योजना, जय विज्ञान मिशन. List 2 प्रमोट मेडिकल रिसर्च, रिमैटिक फीवर, नेशनल हेल्थ मिशन, आयुष्मान भारत। करो जी, मैच द फॉलोइंग, कौन सा किसके साथ जुड़ रहा है? Okay, most of you are going with option B. Catch the tail. Option B, correct answer. Correct answer. I'm so proud of you guys. जैसे भी किया तुमने, जैसे भी किया, सही किया. It is option B. I know because most of you must have taken this PM Samagra Swasthya Mission, beta. That is a new name for National Health Mission. That is a new name for the National Health Mission. So National Health Mission is now renamed as Prime Minister's Samagra Swasthya Mission, and all the health and wellness centers, they have been renamed to Ayushman Arogya Mandirs. This I think everybody needs to know, and सबको पता ही होगा कि what is all this happening, right? So so next is Swasthya Suraksha Yojana, beta. Swasthya Suraksha Yojana, that is to promote medical research and to have aims like institutes in every part of the country. It is to promote tertiary care. It is to promote tertiary level healthcare. That is what is Swasthya Suraksha Yojana, right? Next is Vay Vandana Yojana, beta. Vay Vandana Yojana, that is for Ayushman Bharat scheme. This Vay Vandana Yojana, it is to promote senior citizen healthcare. So senior citizens age more than 70 years, they will get 5 lakh rupees per year as a health coverage under the Ayushman Bharat scheme. So Vay Vandana Yojana, it is to promote health of the senior citizen. And last is Jai Vigyan Mission. Jai Vigyan Mission is to promote rheumatic fever. Not promote rheumatic fever, to promote the understanding of rheumatic fever and to promote vaccine development for rheumatic fever. Rheumatic fever की vaccine के लिए है जय विज्ञान मिशन. So very good. जैसे भी किया, whatever way you used the correct way, and I think you have done it. Let's go to the second last MCQ. इसके बाद there is one more MCQ and that's all. So आपका टॉर्चर यहीं पे ख़त्म होगा. 2.5 घंटे की क्लास थी, वो हमने पूरी करी है. 2.5 hours complete community health nursing. That's what for you guys. Which statement is not correct regarding the disease for which life cycle is shown? क्या बोलते हो? Which statement is not correct for the disease regarding the life cycle जिसका हमने शो किया है? देखो, करो ट्राई. ऑप्शन सी, ऑप्शन ए. Okay. What is this disease we are talking about? What do you think is the disease that we are talking about? क्या बीमारी की बात कर रहे हैं? We're talking about what disease? Nipah virus. Absolutely correct. Very nice. So you've done it. You've done the answer. It is Nipah virus disease. So we are talking about the Nipah virus, NIV, Nipah virus disease. So if you अगर ये आपको आता होता है तो बिल्कुल ठीक है बेटा. This is a small flashcard for you. ये मे बी 1 star MCQ है, कोई पूछ ले तो पूछ ले. Just because के अभी there were outbreaks of Nipah virus, and that's the reason I think someone might ask you about Nipah virus. Someone may ask you. So just make sure कि पता होना चाहिए आपको. You should be knowing about it. So Nipah virus, beta, 2-3 points for you to remember. First is, what is the incubation period? The incubation period is 4 to 14 days. Second, who is the reservoir? The reservoir is large fruit bats. They are the reservoir. The intermediate host is the pig. Okay. Point number 2. What is the most common mode of transmission? Most common mode of transmission is from spillover transmission. That means it is there in bats and pigs and bats and pigs. But sometimes the humans may consume raw dates or palm fruit or the fruit which is infected with the from the saliva or fluids from the bats. So the bats will sit on the fruit. The bats will sit on the fruit, okay, and the bats are going to infect the fruit. The pigs will eat, and there is this pig cycle. Now sometimes the humans may also be infected directly from the pigs or from taking the contaminated fruits. This is what we call as the spillover infection, and that is the most common. Spillover infection, beta, is the most common mode of transmission. Human to human transmission is less. The spillover transmission is more common. The spillover transmission, that is from infected fruits or from pigs. It may come from infected. It could be infected urine also, feces also, anything. Okay, so that is what we call as spillover transmission. The investigation of choice is nothing much. It is RT-PCR, and we don't have a main drug for NIV, Nipah virus. The only thing which we may use is remdesivir or ribavirin or monoclonal antibodies or things like these. But we don't have a treatment for Nipah virus. So obviously fruit bat is a natural reservoir. That is a true answer. Pigs are amplifying. That is true. Human to human is most common. That is wrong answer, which is a false answer. Incubation is 4 to 14 days. That is true answer. So human to human is the best answer for you guys to mark. Last MCQ to close off the day. Which of the following is not correct regarding the MTP Act? I just assume कि आप लोग सब लोग खुशी खुशी जाओ and ख़त्म करो ये lecture को and torture को, and I think you should be answering it correctly. So I just hope that you all answer this correctly. Which of the following is not correct regarding the MTP Act? What do you think? मुझे लगता है कि तुम लोग you get tired and then you start getting wrong answers most of the time. Class for at least 4 hours. क्या बात है, खुश हो गया दिल. Yes, I think everybody answering correctly. धन्यवाद आप सबका. Thank you so much for joining in. And yes, I'm so proud of you. And thank you very much. I was just thinking कि ऐसा ना हो कि last question गलत कर दो. And yeah, it is a direct question, direct answer. Beta, that is what I wanted, that you should be trained to solve new MCQs. That is what my thing is. MTP, only specialist can perform MTP. Yes, this is true answer. The consent of husband is not required. Correct answer. If the female is eligible to give her own consent, we don't need a husband's consent. ये कौन आया? B is locked. MTP is allowed even after 24 weeks. Yes, this is a correct answer. After the approval from the MTP board. And last is MTP is allowed till 24 weeks with one medical practitioner. No, this is wrong answer. With 2 medical practitioners. Till 20 weeks, one doctor or one medical practitioner, and from 20 to 24 we need 2 medical practitioners. So obviously, which is the single best answer for you guys to mark? It is MTP allowed till 24 weeks with 2 medical practitioners. Okay, that is what is. This is a small flashcard for you guys. You can take a cute little picture of this, a screenshot of this, and इस cute little picture को अपने दिमाग में, cute little छोटा सा दिमाग है उसमें डालिए, and you put into your cute little brain, so that when it comes in your cute little exam you are able to answer it confidently. Okay, so so please make sure that you all are able to answer all your all your questions correctly in your exam. I just hope that we have done the justice for your exams. And yeah, the house is now open for any of your doubts. बोलो जी, क्या क्या सुनना है आपने अब? सर, विच बुक शुड आई रीड बिफोर 11 नॉर्सेट? बेटा, यू आस्क योर फ्रेंड्स. अब क्या बोलूँ मैं कि मेरी बुक पढ़ो? अब क्या बोलूँ मैं, है ना? स्वाति शर्मा, बेटा यू आस्क योर फ्रेंड्स. देख लो, अगर आपने मेरी पढ़नी है बुक तो पढ़ लो, नहीं पढ़नी तो मत पढ़ो. सर, टीबी ड्रग्स की अपडेट बता दीजिए. रिगार्डिंग द टीबी ड्रग्स बेटा, रिगार्डिंग द ट्यूबरकुलोसिस ड्रग, you have to remember the drug sensitive TB regime. We are giving 2 HRZE and 4 HR and E. Please note, HRZM जो है, that is a WHO and CDC update and not yet adopted in India. It is not yet adopted in India. Okay, so moxifloxacin, it has been included in the WHO and CDC update but not yet adopted in India. India के लिए आपने यही याद रखना है, the old answer, that is 2 HRZE and 4 HRE. NFHS 5 and NFHS 6 comparison. Please note, NFHS 5 and 6 comparison. I cannot answer this because NFHS 6 the data collection has been completed but the report is not available. Report not yet available. But we only know that in NFHS number 6, anemia prevalence is not accounted. NFHS 5, we accounted for anemia prevalence, for diabetes mellitus, for malnutrition, and for one more thing, diabetes mellitus, malnutrition, and anemia prevalence. And for these all diseases, low birth weight, how many children had low birth weight, malnutrition, diabetes mellitus, hypertension, all these levels were assessed in NFHS. All these levels were assessed in NFHS, right? So NFHS 5 and NFHS 6, there is no comparison. There is, like, I cannot compare it, but yeah, that is what the whole game is. Okay, chalo, next one. Same answer, 56 doses for 56 for HRZE, 112 for HR and E. Anything else? सर, TFR पूछा था. TFR क्या पूछा था? TFR का क्या करना है? TFR बेटा, TFR, what is the TFR in India? TFR in India currently is 1.9. The annual growth rate we already talked is 1.2. This is the recent updates. Annual growth rate is 1.2. नॉर्सेट 11 की प्रिपरेशन कैसे करें? क्या कैसे करें बेटा? NNL ज्वाइन करो एंड वील हेल्प यू प्रिपेयर एवरीथिंग. सर, IFA फॉर एडोलसेंट गर्ल्स अकॉर्डिंग टू विफ्स एंड EMB, राधा रानी साहू. So this is a very frequently asked doubt beta, that what is the adolescent IFA tablets. IFA tablets बेटा single best answer रखना एग्जाम के लिए. 60 milligram of iron and 500 micrograms of folic acid. 60 milligram of iron and 500 micrograms of folic acid. बस यही याद रखना. That is the only thing we have to remember. Nothing much. शिवांगी सर, कनाडा से लाइव. अब क्या बोलें? सर, अनमेट नीड्स फैमिली प्लानिंग समझा दो प्लीज़. अनमेट नीड्स का क्या मतलब होता है? व्हाट डू यू मीन बाय अनमेट नीड्स ऑफ फैमिली प्लानिंग? अनमेट नीड्स ऑफ फैमिली प्लानिंग मीन्स अनमेट नीड्स मतलब जो couples who were supposed to be protected, we could not give them contraception. So these are couples, eligible couples who are not using any contraceptive method, that is called as unmet needs. So that number is called as unmet needs. WIFs and Anemia Mukt Bharat, there is no difference. WIFs is a part of the Anemia Mukt Bharat. WIFs is a part of the Anemia Mukt Bharat program. WIFs is under the Anemia Mukt Bharat program. Okay. Couple protection rate, NFHS 6 data. Couple protection rate, beta, same answer. Couple protection rate is 67%. The total fertility rate is 1.9. सर लक्ष्य में डिलेड कॉर्ड क्लैंपिंग आएगा या नहीं? प्लीज़ रिमेंबर, लक्ष्य इज़ टू प्रमोट लेबर रूम quality of the labor room, and it is to promote delayed cord clamping, which is usually after 1 minute till 3 minutes. 1 to 3 minutes के बीच में we will do cord clamping. It is not done within 1 minute, that is early cord clamping. So Lakshya guidelines, that is for labor room quality. It is to improve the sterilization of the labor room, the equipments and the machines, they should all be working. The sanitization should be there. So that is what is the Lakshya program. HPV vaccine, beta, there is a flashcard regarding the HPV vaccine. What we are using in India, we are using either a Sarvavac vaccine or we are using a Gardasil vaccine. Gardasil is available in 2 strains. We have a 4-valent vaccine or we have a 9-valent vaccine. 9-valent vaccine is the best vaccine, but we do not use the 9-valent. The 4-valent vaccine is most commonly used in India. 6, 11, 16 and 18 strain, they are being prevented with the Gardasil 4-valent, and this was Gardasil 4-valent vaccine was the one which was used in the HPV campaign as well. NFHS 4 and 5 data, forget about NFHS 4 and 5, वो एग्जाम में नहीं आएगा. सर विफ्स और AMB की डोजेस डिफरेंट है? नो, विफ्स इज इक्वल टू द AMB डोजेस. विफ्स इज इक्वल टू AMB डोजेस. Alma Ata conference, beta, it was taken long time ago, 1977, and Alma Ata conference was to have health for all. Health for all was a part of Alma Ata conference, and after Health for All, we came up with the MDG, Millennium Development Goals. After this, we came up with the SDG, Sustainable Development Goals. That is what is being currently used, Sustainable Development Goals. प्रीलिम्स में आया था NFHS 4 and 5 because तब NFHS 4 and 5 में like they were not रिपोर्टिंग का प्रॉब्लम था ना NFHS 4 and 5 में. 5 का रिपोर्ट आ गया था. सो अब तो 5 and 6 की बात आएगी कंपैरिजन. वो भी आई डोंट थिंक दे आर गोइंग टू रिपीट द क्वेश्चन अगेन. नो, इट्स नॉट देयर. सेंसस, यस, सेंसस कैन बी देयर एज अ पार्ट ऑफ योर MCQ बेटा. सेंसस जो है सेंसस गवर्नमेंट ऑफ इंडिया इज प्लानिंग टू कंडक्ट इन 2026 and 2027. The census, there are two like the mascot for census, that is we have what their name, Pragati and Vikas, and this census will be online census, and even self-reporting will be there. So yeah, it was a big change beta. NFHS में, I told you NFHS में there was a big change regarding TFR 1.9. Earlier it was TFR was 2.2 and NFHS number 4. बात NFHS को कंपेयर करके नहीं थी, बात थी कि क्या तुम्हें पता है, डू यू नो दैट इट इज TFR इज 1.9. So they are the things. So it was not about NFHS, it was about TFR. It is online census beta, and that's it. PEP for rabies we have already done. Pre-exposure for rabies beta 0, 3, 7, 0, 7 and 21 and 28 day. 3 doses to be given. HIV update is 90 90 90 वाला old answer है. It is 95 95 95 and 95. It is new update for HIV. So study it in your lectures. HDI, there are no major changes. We have already discussed HDI. चलो, with that मुक्ता भी मैंने अभी बात किया है. दैट इज मुक्ता प्रोग्राम. इट्स अवेलेबल ऑन माई फ्लैश कार्ड. यू जस्ट सी द फ्लैश कार्ड्स ऑन दिस इंस्टाग्राम बेटा. यू विल गेट 90% ऑफ ऑल द MCQs that you asked is on my Instagram update, and you can just join, you can just follow this profile and all the updates will be available to you. Okay, and if you have any doubts, I am always there for you. मैं आप लोगों के लिए ही बैठा हूँ. बट जस्ट डोंट आस्क मी लाइक ओपन एंडेड क्वेश्चन. सर CHN करवा दो. अब ये क्या, मैं CHN कैसे करवाऊँ? या फिर सर कैन यू प्लीज़ एक्सप्लेन कोहॉर्ट स्टडीज़. अब इट्स डिफ़िकल्ट फॉर मी टू एक्सप्लेन एपिडेमियोलॉजी. सर टेलीग्राम पे समवन सेंडिंग मैसेज ऑन टेलीग्राम, सर प्लीज़ एक्सप्लेन न्यूट्रिशन. अब ये कैसे, हाउ टू एक्सप्लेन न्यूट्रिशन? मतलब मैं क्या कहाँ से, मेरे को कहाँ से पकड़ के लाए हो तुम लोग? सो मैं इतना भी नहीं ना कर पाऊँगा कि पूरा चैप्टर ही आई एम एबल टू एक्सप्लेन टू यू. सो जस्ट रिमेंबर दैट एनी डाउट यू हैव, आई एम ऑलवेज देयर फॉर यू. Any doubt you have, you are going to put on this group Telegram. So I am always there for you, and any doubt, I am always 24/7 available on Telegram in the group. Personal message, direct DMs. Yes, if you want to talk anything personally with me, तो ठीक है. मतलब नॉट पर्सनल बट एनीथिंग अबाउट योर करियर, या आपने क्या करना है आगे, या क्या कर सकते हैं आगे, उस तरह के आपने, इफ़ यू वांट एनी काउंसलिंग, येस यू कैन सेंड मी DMs. बट इफ़ यू हैव एनी कम्युनिटी हेल्थ नर्सिंग का डाउट, पुट इट ऑन द ग्रुप. एंड फॉर ऑल द अपडेट्स you just remember you have to see the Instagram profile. So updates में बेटा ये ज़रूरी है. You should remember this, that updates में updates में please remember what is Anmol. Please remember what is Anmol, what is Nikshay, what is Sapna, Meena, what is Nikusht, what is Mukta, Antara, Pragati, Vikas. Rotavirus not under open vial policy. Not under open vial policy. Rotavirus is not under open vial policy. JE vaccine का update you should be knowing. Yellow fever vaccine update you should be knowing. Right? Regarding updates, I'm just talking about the updates. So Mukta, Antara, I think very recently these all has been most of the updates, I think these are the ones. Insta नहीं चलाते तो that's okay. You can just any day use this Telegram group. Or if you have the Facebook page, you can use the Facebook. But mostly people are just talking on Instagram or Telegram, right? So ये सारे टॉपिक्स हैं जिनका अपडेट्स आ सकता है. मेक श्योर दैट यू जस्ट थोड़ा बहुत सा आपको पता होना चाहिए. about these updates, like census ka update, all these updates. Just take a screenshot and thoda pad lena, and make sure that whatever HPV vaccine, yes, HPV vaccine, and whatever beta you remember in all the classes during the workbook, वहाँ पे I gave you all the miscellaneous points about infectious disease epidemiology, and health indicators. These are very, very important. Make sure you study them. These are 5-star important. So वो जो लिस्ट थी 16-17 पॉइंट्स की, वो make sure that you study them. Okay, so with that, I'd like to thank you so much for joining in the session today. All the very best. I just hope that you are able to perform in your exam. And अगर आपको डर लग रहा है, if you think that you are getting scared, that means you are nicely prepared. डर लगना ज़रूरी है, and it is very important. It is very important that you keep on revising, and again last 4-5 days का बचा हुआ है, give your full throttle, जी जान लगा दो, right? हाँ, जिसको डबल टिक लगाने को बोला था, make sure you remember that. Okay, चलो, I have prayers to God, भगवान से, ऊपर वाले से I just pray that you all should clear your exam, and we have lots of hopes on you. खुले दिमाग से जाना. ये ज़रूर मेरी बात याद रखो कि यार बेटा, दिस इज़ जस्ट अनदर एग्ज़ाम. ओके, आई एम सेइंग दैट यू हैव टू गिव योर फुल थ्रॉटल, फुल मतलब जी जान लगा दो. बट बिफोर द एग्ज़ाम यू शुड ऑल्सो नेवर पैनिक बिफोर द एग्ज़ाम बेटा. नेवर. आई हैव सीन सो मैनी स्टूडेंट्स डू द सेम मिस्टेक. एग्ज़ाम से एक रात पहले मान गया डर लगेगा, आई एग्री डर लगेगा. I also know that you will have a fear कि you are going to forget everything, सब कुछ भूल रहा है, but that's okay. आप भूल रहे हो, but आपका brain में memory T cells is not going to forget it. It's like a vaccine. All these things which I am saying, these work like vaccine. They work at a very subconscious level. So अपने आप पे भरोसा रखो, ऊपर वाले भगवान पे. Make sure that you trust your parents, you trust your God, you trust your instincts, and you trust yourself. And make sure that you go with full confidence. डरना नहीं है किसी चीज़ से. This is just another exam. You fight and you will win in the exam. Go with full confidence. डरना नहीं है बिल्कुल एग्ज़ाम में. That पता नहीं यार मुझे वो हो रहा है, पैनिक ये सब पैनिक छोड़ दो. This is just another exam. If you have done your full study, you will clear this exam. Nobody can stop you. MCQs will be simple, pretty simple. Stay with full focus, and don't think that sir Mukhmohit sir ne exact session mein he told all the googly MCQs. Exam mein MCQs are very simple. I have to prepare you at this level so that you are able to perform in the exam which is at a lower level, right? So ye feeling aayega that you will forget everything, but you have to overcome this. Go with full confidence. पूरा तैयारी से जाना है, जोश से जाना है. वी आर देयर विद यू यार. इसमें क्या है, आराम से बिंदास होकर एग्ज़ाम देकर आओ, एंड उसके बाद एग्ज़ाम के बाद अपने को मैसेज करना, ठीक है? तब इंस्टाग्राम चलाना, टेलीग्राम चलाना, एंड ऑल द वेरी बेस्ट बेटा. टेक केयर, बाय बाय.